My name's Charlotte Dawson. I'm consultant in adult inherited metabolic disorders in Birmingham. And I've got my colleague here, Dr. Guha. And between us, we're going to talk to you today about IMD service organisation in the UK and Ireland. So the idea is to give you an overview of how services are organised and a little bit of a flavour of what it's like working within an IMD team, both in a core service and in one of the peripheral clinics. An IMD team is a multidisciplinary hospital-based team. We have a range of professionals working within it, all of whom are essential to patient care and patient welfare. But this slide is trying to show you that at any one time, any one patient may have a different need for various members of the team. So at times they may need the consultant and the psychologist and the nurse. At other times, a patient may need a welfare advisor and a physiotherapist, for example. So it really depends on their condition and their needs as they go through life. And so every member of the team is a very important part of that. But we never forget that we are only one part of their lives, and probably in the grand scheme of things, a fairly small part of their lives compared to those professionals in the community with whom they may interact every day or every week, certainly more often than with us. And that may include a school or college or day centre, the Patient Society, who are extremely professional organisations that provide a lot of support to certain groups of patients. Of course, the family and carers are probably the most single important part of a patient's life, and they really are the experts in that particular patient. So always do listen to them. And then other community health professionals such as nurses, physiotherapists, dietitians, learning disability teams, where our team may signpost patients towards these professionals in the community. Many of the disorders, as you will hear in the forthcoming lectures, are multi-system disorders. So there will be other hospital specialist teams involved in the patient's care. And of course, in adult medicine, we must never forget the GP. In paediatrics, very often IMD patients are looked after by paediatric community physicians, but in adults, that role goes to the GPs, so a very important part of the care as well. Some of you may be aware that the GMC have introduced this set of generic professional capabilities that they've recognised go towards making trainees into professional consultants, and that goes beyond just the knowledge acquisition of their specialty, but is more around professional values and behaviours. And all these are being tested as part of your curriculum in an informal way, mostly, not through exams. But the reason I put it in here is that working within an IMD team, even for only a few months, you will get exposure and experience in almost all aspects of the GMC generic professional capabilities. So you can see there leadership and team working, for example. We have a lot of exposure to working with vulnerable groups, education, training, research, and well, I can think of examples that could fit into all of those. So just worth bearing in mind, because they are increasingly being looked for during your training, or evidence experience of these is being looked for during your training. So how are services organised in the UK and Ireland? And for these next few slides, I just want to acknowledge my colleagues across the UK and Ireland who have provided the information for these slides. They're all also will be giving you talks later in the series, so you will meet them, if we can call it that. Connect with them, perhaps, better word. Right, so I'll start with Scotland, which we've got the clinics based in Edinburgh there, and then we've got the core service in Belfast in Northern Ireland, and core service for both paediatric and adults in Dublin. And then in Wales, the core service is in Cardiff, and then we've got 5 core services in England with a number of red dots you can see there, which are the additional adult IMD clinics, which we will call outreach clinics, which is what Dr. Guha is going to talk to you about at the end of the talk. And then we've got 1 outreach clinic in Wales, in North Wales there. So just a little bit more detail on that. So in England, the core adult IMD centres are in London, Cambridge, Birmingham, Salford. So that's 2 in London, actually, Cambridge, Birmingham, Salford, and they're commissioned directly by NHS England Specialised Services. There's no core adult service in South West England. And core services all provide outreach services. So those were the red dots. Within their region and to the southwest. The outreach services to the southwest are provided by Birmingham and one of the London centres. So to cover patients in the southwest, we have to cross region. And each region has a designated metabolic laboratory service funded again directly by NHS England. And NHS England also commissions designated centres for lysosomal storage disorders and a number of individually ultra-rare complex conditions under the highly specialised services programme. And you will hear lots about lysosomal storage disorders later in the series. In Wales, as I said, the core services are in Cardiff, so that's paediatric and adult, commissioned by the All Wales Specialised Services Committee. There's an outreach clinic in Wrexham for patients based in North Wales. And funding has been secured to develop the Wrexham team as part of a Welsh network with Cardiff as the hub and Wrexham as a spoke. So you will be familiar with this concept of hub and spoke through the organisation of laboratory services. And something similar is planned for IMD services in Wales. In Scotland, the Scottish Inherited Metabolic Disorder Service was only formally commissioned in 2019, though did operate informally for many years before that. And it provides specialist care for adults and children with IMDs within the whole of Scotland, a population of 5.5 million. It's centrally funded by NHS National Services Scotland, and a single team of paediatricians, adult physicians, dietitians, specialist nurses and pharmacists run the face-to-face clinics in Glasgow and Edinburgh, and remote clinics to provide care to patients throughout Scotland, with the lead provider being NHS Greater Glasgow and Clyde. And they also deliver porphyria care as part of the National Acute Porphyria Service run from Cardiff. In Northern Ireland, adult inherited metabolic disorders service is delivered at the Royal Victoria Hospital in Belfast, who look after about 400 adults with a confirmed IMD. This apparently includes patients, as it does in all services, I imagine, PKU, homocystinuria, galactosemia, fatty acid oxidation defects, urea cycle disorders, MSUD, and GA type 1. The service is not nationally commissioned, but is currently seeking funding through the commissioning process. And just a word there about lysosomal storage disorders, which is not provided through the core service at Belfast, but rather through the genetics department in Belfast City Hospital.